From the moment I became pregnant, from the very first scan, there was some abnormalities appearing on the scan that they started testing for viruses, for things like that. She was an emergency C-section at 34 weeks. And then from then she failed to thrive in hospital. I just knew from the beginning there was just something going on with her. Probably 3 months old, I think, we ended up in hospital with severe vomiting, and they did a liver biopsy and discovered some liver fibrosis. That sort of started the further testing a little bit more.
Lily, you good? Thumbs up?
Gareth had rung to say, would she be the first child through the undiagnosed diseases program? And I was like, why are you asking me? Of course, just do it. Pretty much 2 weeks later, he called and he actually said, we have a diagnosis. And I was like, what do you mean? And he was like, we've got one. And then he said this big long name of trichohepatoenteric syndrome. So I was worried. There was sort of disbelief that we finally got a diagnosis, and then I kind of wanted to get off the phone so I could read what it was.
I can't believe I have it. It's just so weird. It's a weird feeling. I get sick often. I stay off school longer. If I didn't have the COVID needle, I'd be off sick lots.
I guess I just thank my lucky stars we had Gareth. He was amazing with Lily, and then the fact she was in the undiagnosed diseases program. Getting those answers earlier would have helped us manage a lot better earlier. She might not have gone through all of the sore tummies and all of the tests and all of those things. But I've got still a lot of friends now that, their children don't have a diagnosis or misdiagnosed a lot. So to have a centre that's their aim, that's their focus, and they're experts in that, I think is amazing. It's something that's really needed.
My name's Dr. Gareth Bonham. I'm a clinical geneticist, and I'm the medical director of the new Rare Care, the clinical centre of expertise for children with rare and undiagnosed diseases. Yeah, so rare is this real misnomer. Rare is so common cumulatively. Because there's 8,000 different rare disorders, there's 63,000 kids living with a rare disease in WA. From data in the USA, which corroborates what we found locally, we now know that rare diseases are the single biggest cost in the health system. If something's individually rare, how do you know how best to treat it? And how do you plan for the future? How do we get even better about globally connecting? Rare Care is a world first. And the reason why it's a world first is we're taking a novel approach, an approach where we think about the whole life journey of the children and work together with all of the sectors involved in their lives. Education, disability, insurance, health, employment. So we're enormously grateful to our philanthropic partners. Perth Children's Hospital Foundation contributing $2.5 million over 5 years. The Perth Children's Hospital Foundation's major donor for those funds, providing $1 million over 4 years, is Mineral Resources Limited.
Mineral Resources is just delighted to support the Perth Children's Hospital Foundation. It directly and solely supports the Perth Children's Hospital. So what it means is for every dollar that we donate to the Perth Children's Hospital Foundation, we know that it's going to get to the children who are being looked after at the hospital.
So we know it takes an average of 5 years for children with a rare disease to be in any shape, way or form diagnosed with the problem and therefore get into a treatment program. So to get involved in this program where diagnosis can happen quicker is essential in our view to changing the lives of these very vulnerable and unfortunate children. One of the great appeals of our involvement in this centre is that it is truly a global centre. It's going to make an impact across the world. It's going to collaborate with a wide variety of overseas partners, both in the clinical space and the research space. So for us to be able to be a small part of a major centre that's going to make a major impact in the global stage is incredibly exciting and something we're very proud of. Rare Care is about helping children and families with rare and undiagnosed diseases live the best lives possible.
I feel very grateful that I've been getting special help. It's very, very grateful.